provide vaccines, but we are also excited to welcome back older adults to senior centers in Baltimore beginning June 1st. So we are very excited about that. And now we'll turn it over to Dr. Jaraza for more information. Dr. D?
Good afternoon, and thank you, Mayor Scott, for your continued and steady leadership. To review our latest case data, we continue to see marked improvements in our COVID 19 metrics. Our daily new case count average is approximately 44 new cases per day, a decrease of 81% from 4 weeks ago. To date, there have been a total of 52,739 confirmed cases of COVID in Baltimore City. 1,004 Baltimore City residents have lost their lives to COVID, and we're now averaging 3 deaths per day. Our current percent positivity is 1.4%, a 68% decrease from 4 weeks ago. Our intensive care unit and acute care unit capacity have also decreased and are both holding at 83% and 87%, respectively. As of today, 54% of adults 18 and older have been vaccinated with either their first or single dose of vaccine, while 45% of adults are fully vaccinated. Mayor Scott stated it perfectly. The finish line is near, it is in sight, but we still have work to do, with our goal being for 65% of adults to receive at least one or a single dose of vaccine in order to lift the indoor mask mandate. Understanding that we have a longer term goal of at least 80% of city residents being vaccinated by early 2022. And this really does require an all hands on deck approach. The Baltimore City Health Department and our clinical partners have been working tirelessly for the past few months to increase our vaccination rates, and over the summer, we'll continue by increasing the number of pop up and mobile vaccination clinics for our residents. However, we fully recognize that the support of community leaders and organizations helps make this work possible and will be vital to achieving these goals. That's why today, the Baltimore City Health Department and Civic Works are pleased to announce a grant program for local organizations interested in setting up COVID 19 vaccination clinics or performing vaccination outreach and education in Baltimore City. Applicants can apply for small grants ranging in amounts from $500 up to $5,000. We're excited to see this grant program support the work of the Baltimore City Health Department's Value Community Ambassador Program. This program has focused on addressing vaccine deliberation in key Baltimore City constituencies, including African Americans, older adults, Latinx community members, individuals experiencing homelessness, Orthodox Jewish community members, young men, pregnant and lactating women, immigrants, pediatric populations, communities of faith, and people with disabilities. The goal of our grant program is to support the work of our value ambassadors to educate and mobilize within these communities as they make informed decisions to get the vaccine. Interested community organizations and individuals can visit civicworks.com/COVAX small grants for more information. Equitably vaccinating residents remains the best way for us to lift our local indoor mask mandate and return to normal. To achieve these goals, we're making it even easier for individuals to know where to get vaccinated. The Baltimore City Health Department has begun releasing weekly online schedules of mobile and pop-up clinics put on by our value ambassadors. These events are specifically focused on areas of Baltimore where there are lower vaccination rates. These sites do require pre-registration, and residents can visit covax.baltimorecity.gov or call 443-984-8650 to make an appointment. Our website also lists schedules for the mass vaccination sites supported by our partners and that are available throughout the city. Most of these sites provide Pfizer vaccine, which is approved in children 12 and up. Our online weekly schedule includes the hours of operation, how to register for a vaccine, as well as the types of vaccines being offered at a site. As a reminder, vaccines remain free of charge and no identification is required to receive your free vaccine. For city residents in need of transportation to get to any vaccine appointment in the city, including appointments at non-city supported sites, we're here to help. The Baltimore City Health Department is contracting with MJ Management Innovations to arrange transportation to vaccine appointments for those who need it. Lift-equipped vehicles are available for individuals with limited mobility. If you need help with transportation, please call 410-372-3444 or email covidtransport@mjminnovations.com. Please plan ahead and call in advance. For our city residents who are homebound, the health department continues working with the fire department and a growing number of clinical partners to provide the vaccine in your home. If you're homebound, please register for the vaccine at covax.baltimorecity.gov. The registration form includes a question where you can indicate that you're homebound. If you do not have internet access, you can also call the Maryland Access Point at 410-396-2273, Monday through Friday, 8:30 a.m. to 4:30 p.m., and our staff will help you register. The Baltimore City Health Department and Fire Department homebound vaccination program began on May 10th, and caregivers are also eligible to receive vaccines at the time of the homebound appointment. The health department is also working with Lutherville Pharmacy, LifeBridge, and Pecor Shalom, and independent homebound providers to vaccinate homebound Baltimore City residents. In practice, every Baltimore City resident should continue to bring a mask with them whenever they leave their home, carrying one on their purse or bag or on their sleeve where it's easily accessible even when not in use. When you're walking down the street or at the park and able to maintain social distancing, wearing a mask isn't necessary. But when you enter a business, use public transportation, or pick up your children from school, you should be wearing a mask. Masking works, and it has been proven to reduce the spread of COVID-19. Public health experts agree that disease transmission is much more likely in indoor spaces, especially when masks can't be worn. This Memorial Day weekend, your vaccination status will determine whether or not your holiday plans are safe. Unvaccinated individuals should still follow the guidance we've provided throughout the pandemic, including wearing a mask, socially distancing, avoiding large crowds, washing your hands frequently, staying home if ill, and getting tested when you're experiencing symptoms of COVID or have a known exposure. Fully vaccinated people can resume activities without wearing a mask or physically distancing themselves except when required by our local laws, including at local businesses and any workplace guidance. Now more than ever, we can win the fight against COVID. Now more than ever, vaccines are widely available, and we know they're safe. We also know that they are effective, as indicated by our downward trends in COVID-19 metrics. Baltimore, we're counting on you to get vaccinated now so that we can all return to pre-pandemic normalcy. It's Baltimore versus COVID, and we will win this together. Thank you.
Thank you, Dr. D, and thank you for your leadership throughout the pandemic. Now we'll take questions.
This is possibly for you, Dr. Daraza. Earlier today, VSA said that they are recategorizing the deaths. I wanted to know for deaths that were previously unreported for COVID 19. I wanted to know if you guys have any indication here in Baltimore City if there are deaths here that would tick up the death toll here.
We imagine there will be. We don't know the final number yet, but we do anticipate that there likely will be some increases for Baltimore City.
And can you just give us an idea, just refresh our memories about this whole mask mandate? Where do we stand here in Baltimore City? Is it just outside where you don't have to wear a mask, inside, and then this percentage thing? Where do we stand with that?
Good question. So outdoors, unless you're at what we call an outdoor venue, so those include our sports stadium or any type of ticketed event, you don't need to wear a mask. If you're at an outdoor venue, it's a ticketed event, then we do require masks. Indoors at all locations, masks mandate are still in place, and so there is mask wearing required indoors.
And you mentioned today we are at what?
54% of all adults 18 and up have received at least a first or a single dose, and our goal is 65% to align with where the state was when they lifted the indoor mask mandate.
So what is going on in Baltimore City why we aren't getting to that 65% mark as quickly?
Yeah, so I think first of all, the state, you really have to look at across all the jurisdictions. And we know that Baltimore City is different from every other jurisdiction. We're a large urban jurisdiction, accounting for about 10% of the state's population. We're much more densely populated. We also house residents who may have more issues with access to transportation and have additional underlying comorbidities. Or we have more residents that are frontline essential workers that can't necessarily take off work to get a vaccine appointment during the day. So the way that we're addressing that is through a lot of the work of our mobile vaccination clinics, understanding that we need to bring vaccine to the people that are highest need. So those areas of lower vaccination coverage are the first places that we're going to go, recognizing that may not be a population that can go to a mass state site during the day.
If I may ask one more for Mayor Scott. So earlier this morning, you were at that event at M&T Bank Stadium. The lines were really long. And the folks for Local 7 are saying that 70% of their workers still are not back working yet. What can you tell us about what's being done to help these people?
Well, I think you heard from Roxy earlier today about the partnership that we've had with them throughout the pandemic. We're going to consistently work with them, not just to make sure that they're able to get the food, get the vaccine. She talked to you about the legislation that we passed to make sure that those folks are the first brought back to work as things open back up. But it's also about us partnering with them to make sure that for some of them who won't be able to go back to their job, that we partner with them to train them and retrain them through the Office of Employment Development and others to get them into other areas of careers that they will be able to succeed in now. These are folks that I have had the pleasure of working with for many, many years. And you saw for yourself firsthand today how upbeat they are, even though they have been impacted by this pandemic more than anyone. And we're going to continue to support them in the ways that we did today and have throughout the pandemic, and we'll continue to.
Roxy was saying that it could be 6 months before we figure out when conventions are coming back, when hotels will be filled up again. Do you have any indication?
All right, go
Do you
ahead.
have any indication right now of what the forecast is looking like to bring these events back?
What Thank you for that question, Eva Joy. Sorry for the fire truck. I think that what we have to understand is that we know we're in consistent talks with our folks that visit Baltimore at the convention center. We know that folks are going to come back. We know again that this is not going to be a rush, and this is not just a Baltimore thing. This is around the country on folks on how we're going to be doing business travel and conventions. We're going to work with our partners there. We also have to be reminded that the convention center is literally a field hospital and a testing and vaccination site. So we're going to work through that as well. We're going to push to make sure that we're getting our conventions back, pushing to bring tourism back in the city. But we're going to do that in partnership with our partners and do it in a safe way so that those folks don't just rush back and then go back to not having a job, as you heard today with some people in the inconsistencies. Ma'am?
Mr. Junior Olympic distance runner. My first question is, what was your event?
Well, there was multiple. I was 4x800, 3200, 1600, and the 3,000 meter steeplechase. So that's hurdles over 2 miles, basically.
I know. So if we keep your analogy, people who just watch track and field or cross country events don't realize that every runner has a plan. And so people might just watch Prince George's County, Montgomery County lifting their mask mandates on Friday and screaming at you, why aren't you sprinting? Why aren't you sprinting? So can you address that? Maybe business owners or the business community who are frustrated that they think they're going to lose because you're not sprinting soon enough.
Yeah, I think that what we always say is that we want to win the race, and we want to being the quickest in the first doesn't always first out the gate doesn't win you the race. Most of the time, it doesn't. If you're a track and field person, that person that jumps out to the lead, we call that person the rabbit because we know that person is going to run out of energy. And what we have done throughout the pandemic is leading the right way. Working with Dr. D, working with our health professionals here at Hopkins and making sure that we're pushing towards that point. We have a plan. We're at 54, 65% is all we have to get through. If folks want to see it happen and go away faster, if folks want us to run faster, then go get vaccinated. Push everyone that they know to get vaccinated. We're not that far. 11% is not that far off. We can do this and do it quickly so that we can get back, because this is about making sure that we not only open up as we have, where we're at 100% capacity, but that we do it in the way that keeps people healthy as possible. And that's the way that we're going to continue to lead.
And question for Dr. Draza. I couldn't help but notice it was the first time I heard you use the phrase vaccine deliberation instead of what a lot of people call vaccine hesitancy. Can you explain why you've changed the language and exactly which demographic group, whether it's age, religion, community area, are you having the hardest time with because they're still deliberating?
Yeah, I mean, so we've done a lot of focus grouping with different communities and found that deliberation maybe just speaks more to what's happening, right? Many people are wanting to see more data. They're wanting to understand how it affected their friends or their peers before making a decision. So they're deliberating. They're not necessarily hesitant. Some may be hesitant, but they're also just deliberating and want to make the best decision for themselves. So felt like that was a more appropriate term to describe what we're hearing. I don't know that there's one particular group, right? What we've done is we focused on a couple of groups early on that we knew were part of our value communities. So we knew that we were going to want to have a message that was more focused on the African American community. We knew that we were going to have a message specific to young adults. We knew that we were going to have a message specific to Latinx because everything that they're deliberating on, it's different. It's different depending on the population. And so we've really, again, worked with focus groups to understand what are the differences, what are the hesitations, or what are you deliberating about based on your background so that we can speak directly to that. And again, we've worked with many trusted messengers. We know that we're not the only messenger that people listen to. Oftentimes we're the last messenger. So really working with our value ambassadors who are part of the community and can do the vaccine education and outreach in a way that's more meaningful and more effective than we can.
So just to follow up to clarify, so it's not like you have, for example, you can't get 20-year-olds to get the vaccine. It's not like one group you're focusing on. Are you just trying to get each group to tick each group up at least a few percentage points?
Focus on every single group. So again, some of the national studies have shown that young people are more hesitant, certainly. But again, I think our focus is on all of the different groups, knowing that their reasons for waiting on getting vaccinated or not having made a decision yet are different.
Thank you.
And I just want to add to that too, uh, especially for the younger folks, those in my age range, we have to be reminded that when we were going to school, we got measles and mumps, we got all these other vaccines, and we don't have measles and mumps anymore. We don't have these outbreaks. We have to make sure that we're being responsible to look out for not just our generation who are mostly young and healthy are not going to die, but everyone else, so that we don't have a pandemic that continues for so long.
Thank you.
Just had a question, a little more about this mask mandate. I know that you want it to continue, but why exactly do you want the mask mandate to continue? I thought the original purpose was to reduce capacity at hospitals to wear the mask, and now that
Well, there was multiple, and I think that we said it very clear today. We know that indoors, right? We know that the patches of the virus is a lot more likely, and we know that people are still dying from COVID in Baltimore, right? Even though our numbers are going in a very good way, we have a target to remove the mask mandate. We're 11% away, and when we get to that point, because we know that reaching that number means that we will have significantly decrease what we call the risk of folks contracting COVID. Thank you.
I have one final question about the action by the school district to progress and to move students along, regardless of their academic achievement last year. Do you have any thoughts on that?
I think a couple things I would say. What we have to do, not just in Baltimore and not just in Maryland, throughout this pandemic, I think we learned something about American education, and that we have to do deep rethinking of how that is, right? I was telling someone yesterday that when you go to college, right, the United States, we measure college graduation success on 6 years, right? Not 4, but 6 years, right? We have to make sure that we are working towards an education system that meets the needs of children where they are and how they learn. We know the system made decisions. We know that other ones around the state are going to be making decisions, probably similar decisions, because you have to think about how it is. Imagine if you, sir, lived in a neighborhood where you lived in a household where there were 5 children that had to use the same internet, and you had 5 computers, but the internet speed couldn't keep up, and that you were struggling, not because you didn't try to go to school every day, but because you simply couldn't. We have to understand that. And when you guys are running these stories, I want you to understand the reality of people in Baltimore City schools and these families. These are our children. These are not pawns for you guys to play on. These are the future of our city. And have that understanding when you guys are doing this, because this education system, not just here in Baltimore, but in our country, this pandemic has showed us that we have to really take that and do it over.
So you support it.
Thank you. Sir, good to see you.
Good to see you, Mayor. Just a quick question for you about when we get to 65%. Is there a date that you're looking at to make that happen? A lot of people are just frustrated that everyone, city, state, everyone keeps moving the goalpost as to when we can get to there. Is there a date that you're looking at?
We didn't move the goalpost. We said 65%. When we get to 65%, we'll take it away.
But is there a date that you're
There's
looking
no
at?
date. The date is whenever we have the amount of people who get vaccinated that will equal to 65% in the city of Baltimore. We will never move the date. 65% is the date. We're at 54% again. I think that that for you guys, that's only 11%. We're not that far away, right? Think about how those numbers have been improving for us in the city over time. And now that we're doing these pop-up vaccination clinics in neighborhoods, we expect to see it go even more. But what we really need is for folks to be pushing, everyone, all of us, me, you guys, pushing to folks, get the vaccine. We can see it, right? We all want to be having, not just here, right? Not just here when Lamar and the Ravens are taking on the Chiefs on Monday night, for everybody to be in the stadium, but also to be across the city and celebrating in the way that we all want to. This is how we can do that. Get the vaccine so that we can move on. Thank you. I'm sorry, Emily, go ahead. I'm sorry. I saw you scribbling, but I didn't know.
A quick question for Commissioner Harrison, actually. I don't want him to feel left out. This is regarding the improvements to the internal affairs unit. I know we've been writing about them. I just wanted to know how you're feeling about the progress that's been made and if you think there's more work to be done.
We see that there's progress. I'm pleased that we've made progress. One of the most important things, two of the most important things we started out 2 years ago was, number one, to increase the staffing. We've done that a number of times, and there's a strategic plan to continue to increase the staffing, but to increase competency. And we've now brought in Department of Justice approved training, and we've now put on a 40-hour course to train every single investigator and supervisor there. So we're pleased with the progress. Certainly, we realize there's much more work that needs to be done.
Thank you.